Good afternoon, ladies and gentlemen. My name is Kari-Beth Lawrence, and I am here today to discuss with you why ABC Hospital Association needs to implement a real-time locating tracking system in order to better manage their mobile medical devices. Throughout this presentation, I will cover a brief introduction of why medical device tracking is necessary for ABC Hospital Association, the literature review I conducted regarding the different tracking systems currently available, the research methods I use to evaluate the different tracking systems, the results of that analysis, and finally, I will go through a discussion recapping why a real-time locating system is the optimal choice for ABC Hospital Association. To begin with, I will start out by going through a general need for medical device tracking before going into an in-depth assessment as to why ABC Hospital Association specifically needs an asset tracking system. Research has shown that more than 1/3 of nurses are forced to spend at least an hour of their shift every day searching for medical equipment that they need in order to treat their patients. This results in frustration for the caregivers, as well as dissatisfaction for patients that are forced to endure long wait times while waiting for the clinicians to find the equipment. In order for caregivers to avoid searching for medical equipment, departments resort to hoarding equipment in their department, which leaves other departments lacking for those same devices. Another method departments turn to is purchasing or renting elevated quantities of medical devices that they don't truly need. Finally, some healthcare facilities have tried to implement their own tracking system, which typically is inefficient, ineffective, and labor-intensive. While it is important to look at the general need for healthcare tracking systems, it is even more important to look at ABC Hospital Association specifically. ABC Hospital Association's very real need for asset tracking stems from increased costs from renting devices such as infusion pumps, being forced to replace lost and stolen medical equipment, maintaining Joint Commission compliance, and maintaining patient safety. ABC Hospital Association has had to face steep costs from renting mobile medical devices due to their inefficient allocation. For example, the emergency department has been known to hoard infusion pumps in their storage closet, say keeping 10 pumps in stock when they only need 5, while the cardiovascular ICU only has 3 pumps when they have a need for 10. The cardiovascular ICU is forced to rent pumps rather than just borrowing from the emergency department. Certain departments have more pumps than they need, like I just said, which, if those were more efficiently allocated, the ED could have just swapped their pumps over rather than having the cardiovascular ICU resort to renting from an outside company. In line with that, small medical devices such as thermometers are either lost in the department or stolen from the department, and the hospitals are required to replace those items. The healthcare facility is also required to maintain compliance with Joint Commission, which includes periodic maintenance on all devices. Having a tracking system will ensure that mobile medical devices are easily found and maintained. Finally, the tracking system will assist with patient safety by ensuring that all medical devices that are involved in adverse patient events are sent to clinical engineering for an inspection before being used on a new patient. Barcode scanning-based tracking systems are one of the many different options available for tracking medical equipment. Barcode scanning systems work by having a light illuminate a barcode, which results in that light being reflected back to a sensor, and that signal is then read by a decoder using a computer, tablet, smartphone, etc. Before 2007, barcode tracking was not ideal for medical devices because they were not required to have unique identifiers until the Food and Drug Administration made a requirement for all medical equipment to have a unique identifier, such as a unique serial number. The inclusion of that unique identifier enabled users to easily create a unique barcode for each medical device. There was one major drawback revealed through the literature review, though, with barcode-based tracking, and that is that this type of system would require line of sight to scan each device as it is moved to a new location. The biggest advantage to barcode-based tracking is that it is very robust, with typically the barcodes taking the brunt of the damage, and those barcodes are very inexpensive to replace at roughly a half a penny a piece. Radio frequency identification, RFID, is another tracking option, which would use RFID tags to monitor mobile equipment by decoding signals between an RFID reader and an RFID tag via a software application. There are two types of tags currently available. There are passive tags, which are powered by the reader, resulting in a small operating distance of roughly a few feet. Or there are active RFID tags, which are self-powered by batteries, providing them with a greater operating distance between the reader and tag. This makes them ideal for mobile applications. However, in order to house the battery, the tag must be considerably larger than those without battery capabilities, which raises some concern for small devices like thermometers. Additionally, RFID tracking systems are unable to track continuous movement on their own. The system is only periodically updated with the device's location, and the system lacks the sophistication to accurately pinpoint a device's location. The third tracking system evaluated was a real-time locating system, which used the same basic principles as RFID systems, including readers, tags, and a software application. But it is more sophisticated than RFID in that it can continuously update with a device's location by using the hospital's network, such as wireless access points. However, the added sophistication for this system comes at a much higher cost than both barcode tracking and RFID tracking. Despite the cost, though, there are numerous advantages to using an RTLS system, including efficiency and quality gains. Efficiency gains include reduced capital expenditures from excessive inventory, reduced costs from renting unnecessary devices, and reduced labor costs from maintaining the rented equipment. The quality gains from RTLS systems include improved coordinated care by being able to locate needed medical devices, improved patient satisfaction from treating patients in a more timely manner, and improved corrective and preventative maintenance on medical equipment. In order to gain a complete understanding of the different tracking systems available, a qualitative comparative research design was utilized. This design was chosen in order to evaluate the similarities and differences between the three different tracking systems gathered from case studies and literature reviews. Since the research was based on information gathered from case studies and literature reviews, the process was based entirely on secondary data. The studies conducted by the authors listed on the slide were found by conducting online database searches as well as general internet searches in order to try to gather as much information as possible pertaining to medical device tracking. There were two primary tools used in conducting research on the tracking systems, which were Microsoft Word and Microsoft Excel. These tools were used to assist with the coding process specifically. Microsoft Word was used to record my observations when going through the case studies and literature reviews. It was also used to extract large chunks of text from articles in order to conduct a search for repeating keywords. Finally, those keywords were isolated by changing font, color, etc. to make the words really stand out. The keywords, or codes, that appeared were cost, operating distance, efficiency, accuracy, and location updating. Microsoft Excel was then used to organize the coding tree, which was created through deductive reasoning based on predefined categories established through the work in Microsoft Word. Additionally, Excel was used to actually compare the results of the codes for each of the tracking systems, and when appropriate, nominal codes were assigned to each category to assist with further analysis. In terms of cost alone, barcode systems are the most economical system to implement due to the fact that the cost stems from the scanner, barcode tag, and software database. The only maintenance associated with this system would be occasionally replacing a half-a-penny barcode and, when need be, the scanner. RFID and RTLS systems have similar costs in that they require readers, tags, and software interfaces. The tags for these systems can cost up to $3 for the actual tag and the layer needed to adhere the tag to the medical device. The distinguishing factor between RFID and RTLS in terms of cost is the operating software. Since RTLS systems have more capabilities, they require a higher cost to acquire and operate, making them the least economical choice to implement. From an operating distance standpoint, though, RTLS is the superior technology because it uses active readers and tags combined with the facility's wireless network to increase operating distance. RFID systems would be the next best because they too operate using active readers and tags, giving them an operating distance of several feet between the reader and tag. Barcode readers are the least efficient because they require line of sight with a very close operating distance of several inches in order to make sure the barcode does not become distorted. From an efficiency standpoint, RTLS and RFID are better tracking systems as compared to barcode tracking. This is due to the fact that RTLS and RFID search for the devices on their own. However, RTLS updates continuously compared to the periodic intervals of RFID systems, making RTLS-based tracking even better than RFID. Barcode tracking is inefficient since it requires an individual to manually scan each device as it arrives in a new department or location. RTLS tracking is the most accurate, followed by barcode tracking, and lastly, followed by the least accurate RFID tracking system. RTLS systems can be as accurate as precisely pinpointing a device with a set of coordinates that correlates to a facility's map. And since it continuously updates, staff would always be able to get an exact location of a device if they need to. Barcode tracking would be the next accurate because barcode scanners are incredibly accurate at reading a barcode tag. However, the accuracy of the system is only as good as the individual updating the database with a given location. Finally, RFID systems are the least accurate because they only update periodically, and during those periodic updates, a device can be removed from a department or even the facility. The final category that the tracking systems were evaluated based on was their ability to update with an asset's location. RTLS by far exceeds the rest of the tracking systems in this category due to the fact that it continuously updates with the device's location using wireless sensor networks or data distribution networks. RFID tracking systems are the next best because they can update a device's location on their own, but the updates occur at periodic intervals. Finally, barcode tracking is unable to update an asset's location on its own. An individual has to manually scan a barcode and update the device's location in the software. In conclusion, after a thorough analysis, an RTLS tracking system is best suited to meet the goals of ABC Hospital Association. It will help the facility efficiently use its medical equipment by giving precision room locations of medical equipment, allowing staff to see which assets are in use and which are in the utility closet waiting to be used. Those in storage in the utility closet could be reassigned temporarily to a department that needs them. Relating back to the example I gave earlier, with this cardiovascular unit in need of infusion pumps, they would easily be able to go into the software and find out that the emergency department had several to spare. They would then be able to contact the emergency department and get those pumps reallocated to them temporarily, which would mean that they wouldn't have to rent any externally at all. An RTLS tracking system would also allow ABC Hospital Association to maintain locations on the small devices like thermometers to prevent having to worry about them being stolen or lost, because they could easily see when somebody's trying to remove them from the facility, and if they think a device is lost, they could use the tracking software to find out where it's located. An RTLS tracking system would also allow ABC Hospital Association to maintain Joint Commission compliance, because the staff that maintain the medical devices and perform the periodic maintenance will be able to locate the devices when they are due for their inspection, rather than relying on the clinical staff to locate the device for them, which also frees up the clinical staff. Finally, an RTLS tracking system will provide ABC Hospital Association with improvements to patient safety by assuring that staff can accurately track a device involved in a critical patient event from that patient's room through the sterilization process, and finally down to the clinical engineering department to be checked for issues. This would prevent a device from accidentally being returned to use and being used on a patient before it has been fully checked out. Finally, it is important when making an investment, such as implementing an RTLS tracking system, to consider how future continuations and expansions could occur. For example, a secondary phase of this project could be continued after the tracking system research has been done to actually do an experimental phase and get primary data. This would involve collecting data prior to the implementation, during the initial implementation, and post-implementation. Those results could then be compared to see whether the RTLS tracking system has been successful in improving the way devices are tracked at ABC Hospital Association. The other element to consider with an RTLS tracking system are future expansions, which can include the ability to track patient movement, especially those of children and elderly with debilitated mental states, track pharmaceuticals like morphine, track laboratory samples from acquisition until they reach the lab, and improve patient workflow by tracking the movements of clinicians and patients to expose areas that need improvement. It is important to consider whether any of these expansions would be considered in the future, because that could determine which software application is chosen as the middleware between the tags and readers, since you wouldn't want to choose a software application that can't actually do the features that you want. In conclusion, an RTLS tracking system is best suited to meet the current and future needs of ABC Hospital Association, making it the ideal choice. At this time, I'd like to ask if anybody has any questions. I've included the list of my references on this slide as well as the next.